Hi, we're in Warsaw, Poland, and this is a place where we have our drop-in center, and you're welcome. When we talk about harm reduction service, it shouldn't be just the equipment exchange, and that's the thing. I mean, when you have needles and syringes somewhere on a shelf in your office or service, it's not enough. It's not a harm reduction program for me. So here it is. Here we are distributing needles and syringes so that people can use new ones. Here we have a room where people can rest, hang out, and spend their time. There are actually two centers, harm reduction centers, who I would call harm reduction services, where people get this offer that is much more comprehensive and it's just not limited to HIV and hepatitis C prevention. We have a kitchen here when people can eat warm meal, which we provide and drink coffee or tea. They can have a shower and wash themselves. This is super important to feel good. And our nurses' room, where we do testing, HIV, hepatitis C, and where also our nurses on the duty helping people with various issues. You need to have social support, material aid, legal support, and many other services and offers to really say that this is the place that people can come in and get what they need.
Harm reduction in Europe and globally is under pressure. And despite overwhelming evidence that harm reduction works, services remain underfunded. And in many countries, basic harm reduction services are not even available. I'm concerned, but most of all, I'm getting really angry. And I know many of you are getting angry as well, because we are tired to being asked what we already know. Harm reduction is grounded on human rights, it's grounded on evidence. Harm reduction works, harm reduction saves lives, and it is cost effective. And in principle, harm reduction is the best thing you can get.
I think that harm reduction is much more than preventing bloodborne viruses and preventing overdose deaths, okay? I think that in many ways we've sold ourselves short. We achieve a lot more than that. We link people into services, we get people into treatment and rehabilitation, we link people back to families, we get people into housing, we deal with trauma. So, there's much more. And what harm reduction as a movement and as service providers need to do is tell that story, explain that to the wider public, to the funders. So we just don't explain ourselves as well as we should.
The harm reduction project from Ukraine. We work with corner at the parties, at clubs, with no protection things like sniffing kit, like condoms and lubricants.
We have party box. Party box included oral HIV test, some supplies for protection, and the main part of this is reagents for testing supplies.
And we really try to be more like a friend for young people.
I'm from a self-support group, so our street workers. We do outreach towards people in great precariousness, concerned by drug using, as us, but also homelessness and all kind of infections and chronic diseases. We are learning here together, and so thank you. Really thank you for this conference.
I'm actually from the U.S., near Chicago, and I coordinate a program distributing Narcan around the area. Mainly came here to learn about European drug policy and really get inspired and bring things back home. And it's been great to meet people from all around the world, and I feel really lucky to be here.
How would you characterize the situation with harm reduction in Iceland?
Well, harm reduction in Iceland actually started really late. Our first harm reduction program was put on in 2009. But since then, we have managed actually to bring up quite a lot of harm reduction services. And on the national level, there is a lot of support for harm reduction. We now have a needle exchange very accessible. We have also opioid treatment in the center of Reykjavik, the capital. We have a DCR, which is both for smoking or inhaling and also for injecting, and also a nurse clinic. Research show that around 50 to 60% of people living in Iceland, they support decriminalization. That's one of the biggest advocacy we see in Iceland, that we really want to push for decriminalization.
We have a wave of new synthetic opioids coming in onto the market. We don't know them yet. We're still getting used to them and trying to find out, okay, how can we make that safe? In Norway, the overdose situation, it has not gone down. It is growing. We have already this year had 20 to 21 overdoses on nitazines, and this is the time where we need to consider all the options we have. Drug consumption spaces, safe places where people can use drugs, safer supply, definitely.
What does the emergence of new synthetic substances mean to harm reduction? Do the traditional programs such as opiate agonist treatment, naloxone, do they work for synthetic opioids too?
Everything works. Everything works, but it has to be revitalized and it has to be revised. So treatment programs have to look at the programs that they're providing. They have to look at the quality of their programs. They have to look at the inclusion criteria. Is everyone included? And of course, overdose reversal medication, naloxone, is extremely important.
Opiate agonist treatment is now a mainstream form of treatment. But what about stimulants? Can we substitute the street stimulants with something?
Well, there's interesting pilots going on across Europe also. In Australia, I know, with, for example, Ritalin or dexamphetamines. We now have a pilot in the Netherlands with slow-release dexamphetamines. So it's still quite in a pilot phase. Yeah.
What about cocaine? I've heard that in the Netherlands you are starting a very early pilot stage program.
Yeah, we want to explore in the city of Amsterdam, which is at the moment very progressive in its drug policy. So we want to explore whether it would be possible, same as with heroin, to have sort of cocaine-assisted treatment, let's call it that, where you basically offer people a legal supply of medical quality or pharmaceutical quality cocaine.
Victor, the Czech Republic is planning a quite innovative way how to regulate psychoactive substances. Can you tell us how you are going to do this?
Yes, in fact it passed already the whole legislation process and it will be effective since the beginning of the next year, a new category of psychoactive products to be on the market for people to be used. Substance with low health and social risks, and it should be new psychoactive substance, so not controlled by international conventions or by EU law, this Council framework decision, as a drug, as an illicit drug. There will be health warning, safety warning, information for consumers, including risks, effects of the substance.
In Malta and maybe other European countries, stigma and discrimination continue to negatively impact the possibility to address certain injustices. For example, one of the biggest issues and one of the biggest pains for me is the availability of an addicts registry, which continues to negatively impact on the quality of life of people who needed treatment and have been put and placed in this registry practically for life. And this is a draconian and an inhumane way how to deal with problematic substance use.
What is your message to those harm reduction services where there is no specific service for women, no specific spaces for women?
So I think we have to address not only women, but also queer and trans people needs. And we need to create, considering the spaces we have. We adapted some existing drop-ins to drug consumption rooms. Now we need to adapt drug consumption rooms that exist also to specific needs of women and queer people.
We are slowly, but unfortunately, I'm afraid, surely going towards a less democratic Europe. We have half the member states that have either a far-right party or a populistic party in the government. If we don't pay attention and if we don't try to redefine and reinvent our role, I think there is a risk for all of us to lose all the benefit of the past 30 years of European drug policy.
The shrinking space for civil society organizations that happens across regions of Central Europe and Central and Eastern Europe and Central Asia, and now it's more evident that is the thing of the Foreign Agents Act is getting more positions in different countries. They will be able to decide if we are friendly and affecting democratization process in our countries, claiming that we are endangering the democratic processes in our countries. Actually, it's completely opposite. So we could be fined, we could be arrested, we could be limited in various different activities, and it will affect our daily lives.
Even in a harsh time when there is criminalized activism itself, criminalized advocacy, like in Kyrgyzstan and Georgia, that's important for us to bring pragmatic public health based on the key value of human life and dignity services and policies. And I have a hope that in the darkest night we could have some countries and some brave politics, and we do have them in the room as well, who could bring these policies.
In Italy, the situation is very hard because we don't have an harm reduction national policy. As the new government is a fair rights government, we are in a resistance phase in our country.
Do you know any good practice how to fight populism?
How to fight populism? Well, it's a very hard question. Maybe we should build an alliance with other movements for the rights of people, like the LGBTQA community and civil society who works for the rights of people from other countries is very important.
We have some very conservative who are against the DCR, always trying to find some argument to close it down. They did that last June. They sent some administrative inspectors in the DCR, in the two DCR, and all around the harm reduction services to get argument to close. And at the end, they produced a report, really positive, that said that the government shouldn't close the DCR and should open other. So it just came back into their face.
There is an ongoing discussion whether we need to reinvent harm reduction. Do you have anything to share about this?
For me, reinventing, it's a big word. I think harm reduction is one of the 4 pillars of the drug policies in Europe. What I would like to see is a standardization of the 4-pillar policy within Europe. There is a polarization between West, we see a lot more drug consumption room opening, and the East being left behind. When the European Union has to answer a crisis, such as COVID crisis, they impose certain standardization. When it's about food industries, there is some standardization. When it's about healthcare and access to healthcare, there is not. So this is something that I would like to see.
The European drug strategy, that's a very nice document on paper, and we worked in preparations of it and evaluating it. And from time to time, the evaluation said that we could not reduce the supply and demand of drugs, so that in governments were pretty unsuccessful in that. But harm reduction is pretty successful, and still what we have is much less resources on harm reduction, and in many countries don't implement the EU drug strategy.
We need to push EU member states to implement the EU drug strategy, to which they all signed up, and implement it in a balanced way. And we need to demand that the European Commission, particularly DG Sante, responsible for health, establish finally and for the first time a dedicated funding mechanism for harm reduction and a health-based drug policy approach.
The overall success would be, to have a 0 HIV cases, full OAT coverage with great treatment and so on. But this small scale is also, I think, something we have to hold on to, you know, when things are so challenging and when you feel that your capacities are so limited. It can start there and very often it ends there, right? A small scale of just letting someone else feel that their life is worth, and that they count. But it's a lot. It's a lot.